Hi, I'm Dr. Fazzarid from the Center for Spinal Correction, New York City, and Body Correction on Long Island. One of the things that I hear a lot from potential clients or potential patients is, I don't have a bone problem, I have a muscle problem. And what we're going to do today is illustrate how that's not really possible. If you have a chronic muscle problem, you're going to have a chronic bone problem, meaning that the bones are crooked. And the reason why they're crooked we discussed in the other video. Hopefully you saw that. I think I have 7 subscribers now, so we're getting there. But if you watch the other video, you'll know that the nature of an injury when you get hurt, and when a person gets injured, and your spine, is that the bone gets pushed forward, and that's the nature of an injury. Once it goes forward, you can never pull it back. So the way your body compensates is it twists in one direction and then in another. Now, what we're going to do today is explain how that twisting affects your muscle function. So, if we can come over to this illustration a little bit. And what I have here are the superficial, this is the most superficial layer, the last layer of muscles that you have on your back. Okay, there are other layers beneath this, but we're not going to describe them. This isn't an anatomy class, but I just want you to understand conceptually what occurs. So we're going to look at 2 muscles, the trapezius muscle, which is this triangular bone, and we're going to look at the lat muscle as well. Now, oftentimes, one of the most common complaints I get from patients is that they have shoulder pain, or they have tightness in their traps, so they call this the shoulder, but this is the trapezius muscle that we're describing here. And they get knots, and they go to physical therapy or chiropractors, and they put high volt machines on this, and they put heat on it, and then sometimes you get trigger point injections. There's a lot of different things that you could do for this. However, it never really clears up the problem. When it's chronic, sometimes it stays there. And not only do they have problems with the trap, but eventually that's going to affect the shoulder function as well. So the trapezius muscle, it has multifunctions. Because it starts, and this is called the origin, all muscles have what's called an origin and an insertion, where it starts and where it ends. So the origin of the trapezius muscle is at the base of the skull, and it also originates along the cervical spine, and it comes down, it comes all the way to the apex of the shoulder, and then it goes all the way in here too as well. It starts all the way, almost down to the mid-back. So it's this triangular bone. Now muscles work by contracting. So if you want to move a bone, the muscle has to be in the proper position to move the bone. So in other words, if you want to bend your arm, your bicep, well then your bicep has to go from here to here, and then contracts, it shortens, and the arm comes up. It's the same thing with any muscle anywhere in the body. So what you have in the trapezius, since it starts here and ends here, what it can do is extend your head and lift your head up. You could rotate, it helps in the rotation. It's not the only muscle that does this. There are muscles underneath this. It also functions on the scapula, the wing bone. It causes it to elevate and depress and retract. It has a lot of function. It also stabilizes a little bit of the shoulder, the function of the shoulder. So it's multifunctional. If you can imagine, this structure is straight. So the trapezius is on one side and on the other. And if this is straight, they will function evenly. But I don't know anyone on the planet, when they come in, has a perfectly straight spine. Everybody has a spine that's a little bit crooked. I'm going to show you that on an x-ray in a moment. So because this area gets a little bent or twisted, where the muscle starts and where the muscle ends is off a little bit, but it's off a little bit all the time. So if you're sitting at a desk improperly or for long periods of time, doesn't matter if you're a CEO or the secretary, you're sitting with your head hunched and your head's positioned forward a little bit, you're constantly straining a muscle. That's origin and insertions are off. And if you're an athlete, it's even worse, because you have a crooked structure to begin with, and now you're actually loading the muscle. If you're a tennis player, again, I love tennis, and you find that this area, these bones are not straight. And there are ways that you could see this. I mean, there's so many tennis pros, if you look at them, their shoulder heights are off. And their shoulder heights are off because their spine is bent into one direction, so the body does this. So that means those muscles are already strained like I'm describing here, and now you have to serve a ball. 200-300 times in a match, or sprint, or hit a backhand, moving your shoulder, and you're doing that through a crooked structure. So now, if look at this is a very important muscle of the back would be the latissimus dorsi, which is this muscle here, right? You do lat pull downs at the gym. Now the lat is an interesting muscle. It actually starts underneath the trap in the mid back, and it also originates all the way into the low back, even at the top of the sacrum. The top of the hip, and then it fans in and it goes into your shoulder. So it's actually the largest superficial muscle of the back. So it starts from here all the way up in here. So we're looking at it's something like this. It starts here and here, actually up until this point, and then it fans out and it goes into your shoulder. Now the lat muscle, there's a lot of baseball players get this problem. A lot of any sport, anybody that's having a problem with their shoulder is going to have a problem with their lat, whether they know it or not. Because its function is to retract the arm, extend it. It aids in pulling down. That's why people do lat pull downs. And it internally rotates the shoulder. Now there are other muscles of the shoulder, but look at the size of this muscle. So if this muscle is off because these bones are crooked, this shoulder's not going to function well. So what will happen to an individual? They'll go to a doctor. I have shoulder pain. The doctor's going to take an x-ray. He's going to make sure there's no cancer, infection, or tumor. He'll test the individual muscles. And they'll say you got a sprain, or you don't have a sprain, or maybe the tendon is inflamed. Well, imagine you're crooked, right? This structure is crooked, and where the muscle starts and where the end is off, and it's chronic, and now you're trying to play through that all the time. So what I have on this side here, we don't really use x-rays anymore. When we still x-ray people, but it's all on computers. But I still have some old films. So this was a 27-year-old male pitcher. He was actually a very good pitcher, college pitcher. And what we're looking at is this. Okay, so these are his hips. There's his spine. Right, his head would be up here. And what happened to him was he had hurt his shoulder. They found that he had a tear that was called the labrum, the top of the shoulder. And they sewed it back. Everything was fine. But he had chronic pain. It never went away. So what I did was we took full spine x-rays of him. And this illustrates how a person's body works as a unit. If you were to look at just this region here, it doesn't look that bad. I mean, for me it does, because I can see these little bends in here. But to the casual observer, it doesn't look bad. But if you look at his whole spine, this is his low back. Can you see that well? This bends one way, actually bends over this way, comes back this way, goes back again the other way. So remember when we talked about the muscles, where they're attaching. The lat muscle attaches all in this region here. Starts all here and here at the hip. And then it comes out and it goes into the shoulder. So if you're just looking at an individual shoulder and you're not looking at the spine, you're thinking there's nothing really wrong, or I'm not that bad. So that's the key. That is why all muscle injuries or strains or sprains, they have their origination in the problem in that the spine is no longer straight. And we can now make this straight. That's what we do. Okay? So if you want to know how it got crooked, you go back to our other video. Why I'm in pain, why I can't get better, and how I can fix it. Alright, so essentially this is it. This is why muscle sprains and strains are really originating from the spine. And what would happen to an individual who stays like this over a period of time, who's crooked over a period of time, and you still play? Well, eventually you're going to wind up pulling muscles. And if it really goes over and you're really straining yourself a lot, you can start, fraying tendons and whatnot. So if you straighten this out, you are less prone to injury. And that's how we... Now, we're talking about athletes in general here, but this applies to anyone. If you're a construction worker, if you're, climbing telephone poles, whatever you're doing, if you have to fight through a crooked structure, you're going to have chronic pain syndromes. And if you could take that structure and make it straight again, that's how you get rid of a problem. Okay, any questions, please feel free to contact us, drdom214 at AOL.com, drdom214 at gmail.com. If you like the video, please give us a thumbs up, and please share it with your friends. Thanks, and We'll see you soon.